Hi, I'm your host Shulabna for today's episode, which is dedicated to a deeper understanding of urinary incontinence. So, we'll be talking to Dr. Abhay Kumar. Hi, Dr. Abhay. Thank you so much for taking out time to answer a few frequently asked questions on urinary incontinence. A very warm welcome to you.
Thank you so much, Suratna, for this opportunity.
So, there are many people who are suffering from urinary incontinence, but sometimes they don't know, sometimes they are just silently suffering. So, this episode is basically dedicated to those people who are silently suffering and they do not seek help. So, my first question to you is, how do you define urinary incontinence in very simple language?
Urinary incontinence or urinary leakage is any unwanted leak of urine, undesirable leakage of urine. So this can be of many types and accordingly they are categorized or defined. Some people have an intense desire to pass urine and sometimes they are not able to hold the urine back. And before there is the toilet or washroom, they start leaking few drops of urine. This is called urge incontinence. That is, they have the very strong urge to pass urine, and before they reach toilet, they start passing urine. So this is unwanted passing urine with a strong urge. That's why it's called as urge urinary incontinence. There is a different scenario when some people, particularly females, whenever they cough or sneeze or they laugh loudly, they leak few drops of urine. 1 or 2 drops urine comes out. So again, this is unwanted urine leakage, an undesirable thing. This is called stress urinary incontinence. That is, whenever there is any increase in the pressure in the abdomen, or there is any stress in the body, some amount of urine leaks. But sometimes these two things are, both of them are there in one patient. That is what? Mixed urinary incontinence. That is, they leak urine when they cough or strain, and they also have a strong urge to pass urine and they can't hold it back and they pass few drops urine before they reach toilet.
The risk factors, or what are the situations which aggravate these conditions?
It can be because of any urinary tract infections. It can be any problem like stones in the bladder, stones in the kidney, or any tumors in the bladder, tumors in kidney. But most of the time, when we rule out these factors, then we see a condition which is called overactive bladder.
You mentioned overactive bladder. Can you help me understand a little about that? And is this a cause for incontinence, or this is again a similar disease like incontinence?
So overactive bladder is a problem with the storage of the bladder. So the bladder is not able to store the urine for the desired time. And during this time, the bladder is very active, kind of sensitive, and keeps on pushing urine out. And the sphincter is not able to hold it back and will start leaking some urine.
So what causes overactive bladder?
Yeah, so this is a very important question. Right? So overactive bladder is a diagnosis of extrusion. That means we're thoroughly tested a patient, tried to find out what is the cause of this incontinence, and it could not find any cause. Like there is no infection in the urine, there is no stones in the urinary tract, there is no tumor in the urinary tract, no any anatomical changes in the urinary tract. But still the patient is having these kind of symptoms. Then we label this patient as a overactive bladder. There are certain subtle neurological receptor level changes in the bladder, which are not picked up on our routine investigations. And there are no other neurological causes which are visible in even those patients as overactive bladder.
Okay.
Cause for these can be anything. Like DOTIs are quite common cognitive.
Okay.
The patient has a repeated history of you get infection, they may later on maybe having overactive bladders.
Okay. And this is common both in men and women, overactive bladder.
Yes. So this is again make that this overactive bladder is only in females. It's not the fact. We see a lot of patients, male patients, who have got bladder problems, and overactive bladder is a common problem. So it may diagnosis is very easy, depending on your clinical situation, depending on what kind of incontinence you have. It would is either constipation or bowel. Many of these patients are usually constipated or they have irregular bowels. Since bowel management is very important, it would make the urinary bowels better. If you are having a stress urinary incontinence, or if your pelvic floor muscles are weak and you leak some urine whenever you cough or sneeze, then again the treatment is some lifestyle changes, some exercises. What's most important here, we focus on Kegel exercises, on the exercises which can strengthen your pelvic floor muscles. But the problem is many patients don't identify which muscles are important as pelvic floor muscles and which muscle needs to be strengthened. That's why there are certain therapies like biofeedback therapies and others which help these patients identify those muscles and get a better result in those kind of incontinence.
So, Doctor, I would want to know if you will have any key take-home messages for our audience.
Most important is if you have a urological problem like this urinary incontinence, please open up, discuss. There's no shame in talking about your urinary problem. First start talking to your own family members. And there's the message for the young listeners or young viewers here, right? And many of the females, elderly females, are not that well taken care of in the family. And many times these old ladies also don't complain or ask for help. So it's a message to the young listeners here that if you have any old lady in your family, like Dadi and Nani or whoever, and if you feel that she goes to toilet very often, or she remains awake in the night and she keeps on moving to toilet very often, or if you feel that she has started, or she has stopped going to public places because Bombays, or if you feel that she keeps on smelling like urine all the time, then please take her to a urologist. She needs professional help. She is silent because she doesn't want to discuss these urinary problems, and most likely she feels that this is part of aging, this is part of life, and maybe there is no treatment for this. Is help this lady. Things can be managed in a very easy way, and maybe you can have a very satisfactory outcome.
Right. It was quite insightful, and I think a very emotional aspect also you touched. It was great having you for the podcast, and thank you so much for your time.